We begin tonight in Springfield as calls continue to grow for police departments to change the way that they respond to 911 calls.
Police Commissioner Clapprood addressing the police department's mental health response this afternoon. Western Mass News reporter Lexi Oliver joins us live outside the city's police station with more. Lexi.
Chris and Jordan, Amherst and Northampton have already adopted separate departments intended to shift mental health and drug abuse calls away from police. And Commissioner Clapprood says she's watching those communities closely.
How can Commissioner Clapprood allow police officers to come out of that building seeing fear in their eyes? Fear in their eyes, and then when they come out into the community, if they have that fear with the gun, it usually costs the lives of black people.
Minister Charles Stokes, spokesperson for Orlando Taylor III's family, responding to a comment Springfield Police Commissioner Clapprood made when speaking on an unrelated officer-involved shooting in an MGM parking garage. Speaking at a public safety subcommittee meeting Monday, Clapprood did not specifically address the Orlando Taylor case, but she had this to say defending her comment.
I mean, when I say I saw fear in their eyes, that's human. And you don't go through an event like that and not after the event stop and think how close you came to death.
This comes as the Taylor family continues to call for a better response to mental health incidents. They claim Taylor struggled with mental disabilities prior to the 23-year-old stabbing an officer, then being shot and killed on January 9th. After reviewing the evidence, including police body camera footage, the district attorney determined the officer-involved shooting was unavoidable.
We want policies put in place. The Orlando Taylor III Act. We want a crisis center put up here with Orlando Taylor III so that culturally competent services could be rendered to the African-American community.
At Monday's meeting, Commissioner Clapprood says the department has 6 trained behavioral health network clinicians operating. She tells Western Mass News BHN responded to nearly 2,000 mental health-related calls with officers in 2021.
When it first started, they were skeptical of having BHN civilian on their calls with them. Now they don't want to go to call unless they got a BHN worker with them.
Some community members continue to question if police should be responding to mental health calls at all. In Western Mass, Amherst and Northampton have already adopted departments that respond to certain police calls with just civilian personnel and no armed officers.
I am watching Amherst and Northampton very closely, and we'll see in a couple months here how they do.
When asked about how officers' mental health is being addressed, Clapprood says they've implemented a 24/7 internal support system.
We started a peer-to-peer program here, and we trained about 12 to 14 officers. What I found that the most important time is to talk to an officer before they go home at the end of their shift.
She adds that any officer involved in recent traumatic situations have been referred to that peer-to-peer program and had a total critical incident training where they were provided with additional resources. She also says she's working to continue carrying officers administratively with pay while they get the help they need. Live in Springfield, Lexi Oliver, Western Mass News.